Okay, so we had a very constructive executive meeting. I was delighted with the consensus that was achieved, with all of the executive colleagues agreeing to the recommendations that Michelle and I made to them, which had the support of the Department of Health. So from tomorrow at midday, we will be able to lift the rule of 6 and table service only within the hospitality sector, as well as the guidance being lifted for domestic settings, the cap that had been on that there won't be a cap any longer in terms of those numbers, and also in terms of the guidance on working from home. We're reverting to what is our baseline measure within the autumn-winter contingency plan, which is still recognising that we're encouraging people to work from home where you can, but we accept that in some circumstances that isn't going to be possible. And then from the 26th of January, at 12 noon midday, nightclubs will be able to reopen. The prohibition on dancing and hospitality will be lifted, and also the legal requirement in workplaces to achieve 2 metre social distancing will be lifted. And then the mandatory COVID passport scheme will be reduced to only apply in limited circumstances that relate to nightclubs and indoor unseated venues of 500 people or more. So this is very welcome progress. The 10th of February will be an important meeting now for those outstanding measures that are still in place, and until that point, if changes are to be made, I encourage people to follow the regulations and listen to that public health advice. But I think the public will be pleased with these decisions that we've been able to take. It's proportionate, it reflects the changing circumstances that we have in respect of COVID, and it is a step in the right direction, and hopefully we will continue to make progress at our meeting on the 10th of February.
So today's decisions have been very much informed by both the Chief Medical Officer and the Chief Scientific Advisor. They've been guided by the health advice. It's very clear that we appear to be now past the peak in terms of case numbers, but also in terms of hospital admissions and bed occupancy. So that's crucially important information to understand why we're able to move forward today. That, alongside the fact that so many people came forward and have achieved both vaccines and also the booster vaccine. So it is a good positive step today. We do remain cautiously optimistic, but we still ask the public to work with us. We've got to this point because of public support. We encourage that to remain in the time ahead, and we'll continue to keep the remaining restrictions under review. But the 10th of February has been earmarked as the next big staging post, if you like, in terms of what happens next. But I think today's progress is to be welcomed, but it doesn't mean that we get complacent. It means that we just double down on the remaining measures that are there and still remain cautious.
Okay, Garth Fulton. So you announced that you're lifting so many restrictions, easing so many restrictions, and you've done it there. Why do you feel that it is okay to take this course of action?
Well, I think it's a combination of reasons. I think it's the vaccination rates that we've now achieved. The public have been excellent in coming forward to both get vaccinated, but also to get, and their double jabs, but also to get the booster vaccine, and that remains our best defence against this variant and future variants. So that has been a major factor, but also because we have passed the peak of cases. There was probably 18,000 cases per day at a point over the last number of weeks. So we've had very high levels of cases, but we're past that peak in terms of both case numbers, but also crucially hospital admissions. And I think that's an important factor. So all our decisions today are based on the best scientific and medical advice that we have. So I'm glad that we've been able to make this progress. But again, I just would like to strike that note of caution. Still remain cautious, still wear your face cover, and still come forward if you haven't yet for your vaccine.
Yeah, the progress that we've made is as a result of the public working with us, and before Omicron really arrived in Northern Ireland, we asked the public to go out to get their booster jab, to increase the levels of vaccination, and they responded. And they also took decisions on their own without the need for legislation to minimise social contact and to take sensible precautions. All of that has helped us to reach this point today, where we're able to make these announcements around lifting these restrictions. That's the right thing to do. Restrictions, we have always said, should only be in place for the period in which it is absolutely necessary and not a moment longer. That's why we've acted so quickly, from having introduced these measures only on Boxing Day. Within weeks, we've responded to the changed environment. That's the right approach to take, and hopefully we'll be able to continue to make progress.
Afternoon, Ministers. Jane McCormack, BBC News. Can you both stand here today and say that we are not going back to anything like we've had in the past now? just let that noise just go past. Is this a turning point now? Do you really believe that? And just a second point, is there any concern around a mixed message here? Because Mr. Allen, you talked about the need to still be cautious. There are still people in hospital. There is still a large number of cases. There is maybe a concern from some people out there that they don't quite know where they are left now with COVID.
Well, firstly, is it a turning point? I think that's yet to be seen. That's why I think we shouldn't get carried away, because we are still in the middle of the pandemic. We still have a really significant high number of cases every day. So that's why we need to be cautious in our optimism. If there's one thing that's for certain, and you've heard me say this many times through the pandemic, it's just surrounded in uncertainty. I hope that we never have to go backwards, but you have to always be honest and say that you can easily get hit with a curveball in the pandemic. So with the public's continued support, to continue with the measures which we still have in place, then things do look that bit more positive and there's a bit more hope. And you know, we've had almost 2 years of this and people are tired. At the same time, I also understand that people are still cautious. So I would just reassure the public that every measure that's been taken today has been guided by the health and scientific advice. It's fully backed by Chief Medical Officer, Chief Scientific Advisor and all ministerial colleagues. So it's the right thing to do for today, and I'm glad we've been able to make this progress, but please be careful, and if you haven't yet got your vaccine or your booster, please come forward and get that, because that still is our biggest defence.
And all of the evidence is moving in the right direction for us stepping out of a pandemic into an endemic phase of this virus, and that means that we don't need to have the same restrictions being deployed through what was emergency legislative provisions. And so we're taking these changes today. I think it is a cause for people to be optimistic. For so long people have been fearful, they've been anxious, and now we're in a much better place. We still need people though to be cautious, to put into good practice all of those things that they can take decisions for themselves, but the requirement for government intervention is no longer justified in the way that it may have been previously. That's why we're taking these steps today to step us out of where we have been over that Christmas period.
Minister, with such a widespread series of reductions or easements of restrictions, is there a danger that this sends out the message to the public that the pandemic is over and that they should let their guard down at a time whenever we know the hospitals are still under such pressure, and the schools we're anticipating a rise in cases there also?
Yeah, that's why it's very important that we drive home the message that we're asking people to still remain cautious. This virus is still spreading quite rapidly, and whilst it may be on the decline, it's still coming from a very high baseline. As I said, 18,000 cases per day perhaps we've been witnessing over the course of recent weeks, so that is cause for concern. However, protections are there to protect the public at a serious point in time, and before Christmas we were in a very worrying position. This Omicron variant has turned out to be not as severe as it was potentially predicted, and that's a good thing obviously, but we still urge that caution. Today is a good day, it's a hopeful day, but we're not out of the woods yet, so we just need the public to continue to come forward, get the vaccine and follow the public health advice.
And over the Christmas period, there were measures introduced in terms of hospitality and nightclubs, but we didn't go as far as the Republic of Ireland, for example, that put a curfew on hospitality at 8 p.m. That is something that we didn't do, and that was the right thing. Scotland and Wales went much further than Northern Ireland. England, some would say, didn't do enough. We charted the path that we believed was right in Northern Ireland. And now that we've lifted those measures, I think the public will still take their own decisions. My grandmother on my mum's side of the family turns 100 this weekend. We'll still be careful in terms of how many people are going to be in that home, and make sure that we're cautious and put into practice the proper measures that need to be done. We didn't need legislation though to take those decisions, and the public have got information. They're empowered to take those decisions and exercise their own personal responsibility in respect of that, and I encourage people to do that.
Excellent. Minister, speaking very public terms about the vaccination rate, could you spell out exactly what vaccination?
Well, first let me say the public have been absolutely excellent in coming forward to get their vaccines and their boosters. We now have over 90% of the population doubly jabbed, and over 60% of the population have also achieved or come forward for their boosters. So we encourage more of that in the time ahead. Today is not a reason for anybody to fall back from any intention to get the vaccine or the booster. We absolutely still encourage that today.
Chelsea?
Can you touch on it there, First Minister? It might be too soon to say, or it might be a bit of a leap, but has any of the health officials given you a date to look towards when this when COVID might turn into something like the common cold, where it is part of daily life. Have you seen any modelling or any dates that I suppose could give us further hope that this will end at some point?
Well, it's difficult to say a particular date whenever we're officially moved from pandemic to endemic, but I know our Chief Medical Officer engages across the 4 nations in the United Kingdom on this. He engages with the Republic of Ireland's Chief Medical Officer as well in terms of what is the latest data around the virus and the way in which it has been changing. And so they have said that we are moving towards that endemic phase of the virus. And that means it's just much more widespread within our community, but we do have much higher levels of immunity, and that's been through the vaccination programme. It's also now through naturally acquired immunity. All of that is helping now to build up the resistance to this virus, and as you move forward into the months ahead, then COVID will be managed in the way we would be managing other endemic forms of viruses. That means it's still a serious virus. That's not something that anyone would want to contract. But we don't need to manage it in the same way that governments have done so over the past 18 months. We have to reflect the way in which this is changing. We need to allow our society to get back to as close as normality as we possibly can. And I look forward to the day when we don't have any restrictions imposed on people as a result of the emergency legislative process. These laws were introduced in a way that I don't think any legislator would want to have introduced them, and I look forward to the day whenever we don't have that emergency framework in Northern Ireland and that we manage these things through the normal processes.
Okay, thank
you.
you. Thanks.
Thanks.
Cheers. Sorry, just Mr. Turner.
What do you want me to ask me in English?
I'm going to ask you something.